Hi, I'm Tracy. I'm a 12-year ostomate, and I have been working with patients with their ostomy needs for about 30 years. I've worked with home care nurses, WOCNs who are the best in the world, and here's a couple tricks that I have on a daily basis. So this is my kit. I travel with this all the time. I have one in my purse, one in my car, one in my desk drawer. And you're going to say, this is a lot of stuff to carry with you, it's kind of big. Well, if you have a leak, you're going to be so grateful to have this. So man or woman, if you have access to put this somewhere, stash it somewhere, change it out every once in a while to refresh your products, you'll be grateful that you have it when you have an issue. So thankfully I don't need mine very often, but when I have needed it, I'm so happy. So this is an underpad. A lot of people think this is crazy, and this is a pretty big one. You can buy much smaller ones, but I love an underpad because if you're in a public bathroom, you don't necessarily have a place to put your things. So I put it over my lap, and then I have a little table to put my things on. But additionally, it's clean. Some bathrooms are not ridiculously clean, and I don't want to put something dirty on my body if I can help it. So this is just a nice little table. But also, if my ostomy is active and I've taken off my pouch, where is that going to go? So it's going to go all over the front of you. So this you can just tuck up underneath your ostomy, and it goes on the underpad instead of on your clothes or the floor, which then you end up having to clean up. So very important for me. So I have my powder, I have my paste, I have my ring, my extension strips, my Secure, and of course my pouch. So the other thing I like to throw in here when I'm diligent about it is a Q-tip, because if I'm going to use the paste, I don't want the goo on my hands, so I use this. And that's just me, other people don't mind it. And then I try to carry a pair of scissors, because then I can cut my appliance, whether it's a one-piece or a two-piece. This happens to be one piece, but I can use it, I can cut it to fit. Now, it makes sense to cut these before you leave, before you walk out the door, so you don't have to have the scissors. But if you have it in your purse, your desk, your car for a long period of time, your stoma might change size or shape, and so cutting it that day might be your best bet. So use your discretion at that. And for me, I have found having these scissors are hugely valuable, not only for ostomy things, but just for my daily life. So they travel well, they're rounded, they're safe to travel with, and they help me with my ostomy stuff if I need to get into something, or if I'm being impatient, which is normal. I can cut through things much easier. So that's it. I keep it in a nice little Ziploc bag. Any brand will work. And get all the air out of it, and everything is nice and tidy. And then if I happen to use any of the pieces in here, or all of them, I just replace them. And I have a nice, easy kit, and I don't have to worry about it when I travel. And then of course my underpad. And sometimes I'll put the underpad separate, because then it makes this much more compact. And now I'm ready to go, and I'm confident if I'm somewhere out and about and I have a leak, I can at least get my appliance changed until I can get to a place where I can do a full cleanup and a full, nice, perfect change. And sometimes those are on the go and they work fine too. But that's my tip. Thanks so much.